We've recently been informed that Selby and Scarborough have been added to the national watch list as areas of concern. This is following on a marked increase in the number of infections that we've seen in those districts since the beginning of September. The pattern of spread has been largely in households and through social contact. It's important for people living in Selby and Scarborough at this time to be extra vigilant about the messages to ensure we have scrupulous hand hygiene, that we maintain our social distance. It's important that we stick with the rule of 6. As I said, transmission has been through household contact and through social contact. So limiting the number of people that we interact with makes sense and will indeed help us gain control of the rising tide of infections. We also want to encourage people in Selby and Scarborough that when they leave home to use face coverings. That will add another level of protection and help us to gain control over infections. Finally, think about the more vulnerable in our population. Yes, many people who are infected now are younger people who may not themselves become severely ill. However, many of the people who are infected work in care homes, they work in school settings, they work in workplaces where other vulnerable people may exist. And it's important that we prevent these infections from becoming cases in which people become ill, hospitalized, and unfortunately may die as a result. If we act together, if we act now, we have a good chance of gaining control of the situation and beginning to see those numbers decrease in the next few weeks.